Good evening, everybody, and welcome to our Town Hall COVID-19.
Not yet. It's sorry, it's just pushed, but don't start yet. Sorry.
I see it.
Okay. All right, go ahead, Ted.
Good evening, everybody, and welcome to our Town Hall COVID-19 and our community facts, myths, and overcoming fear. We will begin in just a couple of minutes. We want to give people time to join us via Facebook Live. We do appreciate you spending some time with us this evening and just ask that you stand by for about a minute or two and we will get started. Thank you so much. Good evening, everyone, and welcome to our Town Hall COVID-19 and our community facts, myths, and overcoming fear. My name is Ted Burton, and I'm Vice President of Communications for Central Health, and it's my pleasure to be your moderator for tonight's conversation. Central Health and Community Care are honored to partner with Community Coalition for Health and a number of local churches to bring you this town hall, and it is a first in a series. Central Health is the Travis County Health Care District, and Community Care is an affiliate of the Central Health Enterprise and one of the largest federally qualified health centers in Texas. Tonight, we hope to have a very candid conversation about barriers preventing communities of color from getting the COVID-19 vaccine and what we can do together to address and remove these barriers. Before I introduce you to our panelists and invite Austin Mayor Steve Adler to provide a brief welcome, we'd like to begin this conversation tonight with an invocation. Dr. Moody, would you do the honors, please?
Sure, Ted. Father, we thank you that you allowed us to come together on this evening to discuss matters that are so important, not just to our community, but to you. God, I ask that you would touch each one of our speakers on this evening to allow us to communicate clearly the need and communicate clearly the responsiveness to this COVID vaccine. We live in a city, we live in a country, we live in a world that seems to be divided on so many levels. Tonight, unify us. In Jesus' name we pray, amen.
Amen.
And thank you, Dr. Moody. Let me see if Mayor Adler has joined us yet. I know he has another meeting that he is attending, so we'll continue, and when the mayor joins, we'll pause and offer him the platform to make a few comments. Before we begin the conversation, I would like to welcome our panelists and let them introduce themselves. Joining us tonight are Pastor Gaylon C. Clark with Greater Mount Zion Baptist Church, Archbishop Sterling Lands with Calvary Baptist Church, Dr. Charles Moody with Community Coalition for Health, one of our partners, Dr. Clifton Peele, a physician with Community Care Health Centers, Giesson Fournier, the Community Care CEO, and also Mike Giesson, President and CEO of Central Health. Pastor Clark, would you please introduce yourself and say a few words about why you agreed to join us tonight, and then the others may follow and do the same.
Gaylon Clark, again, is my name. It is a great privilege for me to pastor the Greater Mount Zion Church in East Austin. And I'm here because I've had to say goodbye to two of my mentors who mentored me in ministry and marriage and just a host of other ways in which they contributed to my life. And I've had to do eulogies for two additional people. And I guess I just want to be a part of doing everything that I can personally to make sure that fewer people contract this virus, and we do our part to make that happen.
Thank you so much, Pastor. Archbishop Lands.
Thank you very much. My name is Sterling Lands, and I'm proud to be the chief servant at the Greater Calvary Bible Church and the presiding bishop of the Family Life International Fellowship. I'm here because our people have been devastated across the country by this COVID-19 attack. And the pandemic is very real, but it's even more so in the communities of color. And we need to do something about that. And I would like to lift my voice and join with these others, Pastor Clark and others, in making certain that it's very clear. If we don't do something ourselves, we can't blame anyone else.
Thank you, Archbishop. And my apologies for saying Baptist Church. I had it written Bible and I just missed. So my apologies.
That's okay. I love the Baptist Church.
Dr. Moody, would you please introduce yourself and talk about why you're here tonight?
Hi, I'm Dr. Charles Moody. I am a senior pastor of the Rock ATX and also the CEO of Community Coalition for Health. And I'm here because like Bishop Lance, I think it's so important that we make some decisive decisions about what it is we're going to do as a people, and that we've been devastated by the effects of COVID, unlike many other communities. And so there are particular needs in our community that I want to make sure that are expressed, they are extended, and people are empowered to actually embrace an opportunity to be healthy, an opportunity to live. And I also, like Pastor Clark, have buried a member and seen people who have passed away and had relatives who've been stricken by this disease. So I think the time is now.
Yeah.
Thank you, Dr. Moody. Hi, Dr. Peele. Thank you for being with us tonight.
Greetings. My name is Dr. Clifton Peele. I am the clinical and surgical podiatrist for community care. And the reason why I joined this great panel we're going to have tonight in discussion about the COVID-19 vaccine is because, like many of the aforementioned people have already stated, this virus is quite deadly in the African-American community, affects us at 2.5% times higher than other groups, and also has a likelihood of death toll of 50% mortality if an African-American contracts the virus. So this conversation is very important for us to have and to express the benefit of the vaccine to the African-American community.
Thank you, Dr. Peele. Giesson Fournier has joined us. Thank you, Jason. I know you and Mike had to make a quick transition from another community meeting. So thank you for being here. And if you don't mind, would you just introduce yourself and explain why you wanted to be part of this conversation?
Yeah, absolutely, Ted. And good evening, everyone. And so much thanks to my colleagues that are on the panel. This is such an extremely important topic for all of us. The way we get past the coronavirus pandemic and COVID-19 and its devastating effects is by really getting vaccinated. And this issue is so important to us at Community Care and for me, both professionally and personally, to make sure that everyone within our community has first access to the vaccine. And then for those that are maybe a little bit hesitant, that we get information, because information and knowledge is powerful about the effectiveness of the vaccine, what we've seen already, as well as just going ahead and taking a look. One of the things in our own data that I'll get to share a little bit later is that we are unfortunately seeing a lower level of vaccination rates relative to our patient population as a whole for African-American brothers and sisters. And so really want to help support awareness about why it's critically important for all of us to get that vaccine. So I really appreciate the opportunity and privilege of participating this evening.
Thank you, Jason. And also Mike Giesson, the president and CEO of Central Health, is here. And Mike, did you want to say a few words?
Well, first of all, I want to thank all the members of the panel for joining us. And obviously there's compelling personal stories behind this. And so I appreciate you all sharing that, because I think it brings us all into the perspective that we need to have as we combat this virus. Thank you.
Thank you, Mike. As we begin this conversation, I wanted to let people watching from home or wherever they might be know that we will open up this conversation for questions. If you're joining via Facebook Live, you can drop questions in the comment section of Facebook Live, and we will try to respond to as many questions as possible during our brief time together tonight. But if you continue to leave comments, our team will monitor those questions and comments as we receive them, and we will respond to them as quickly and appropriately as possible. So Jason, if we could begin with you, could you provide us with a current state of vaccines in Travis County from Community Care's perspective, but specifically when it comes to vaccinating communities of color?
Yeah, absolutely, Ted. And I think you guys are going to share some slides for me, correct?
I didn't receive the slides, but we're happy to. We do have them. And I think we can share them.
Yeah, and as you're pulling them up, so for your awareness, thanks to our partnership at Central Health and taxpayers here in Travis County and so many other partners, including our churches that are critically important to getting the word out. I think when we take a look at how we're doing as a community, we're doing okay, right? There's a lot of great work that's being done by our partners at Austin Public Health and so many others. But there is and continues to be persistent disparities that are occurring. When we look within our own community, we know that the vaccination level is skewed further west of I-35, which also cuts along lines where we know that there's differences in affluence and wealth comparative to Eastern Travis County and east of I-35, where many of our minority communities reside. And of course, a lot of this and the disparities and the communities that we're so privileged to serve and where our health centers are there for a reason. And they're there to connect folks with the care that they need and deserve. But if we take a look, much of what we're observing in this disparity and the inequity of the distribution of vaccines was very predictable. Communities that have a lack of pharmacies have little to no medical providers that are available to them other than what we provide or perhaps other health centers provide within the area. So as we take a look at that, one of the things that's important to recognize is these disparities aren't only unique to COVID-19. I think we'd be remiss to say that this is only about COVID-19. The disparities really are longstanding and are rooted in both racial and ethnic segregation and policies over the years that many of you guys know better than I do. And so as we start looking at the data, mindful of the fact that we've got a lot of work ahead of us, the good news is based on information that's shared from Austin Public Health Department and Community Care's Data Incorporated, we now have over 285,000 individuals in Travis County that have received at least their first dose overall. And so when we take a look at that and not having if we can proceed to the next slide, Ted. And so when we take a look at the data itself, when we look at the folks that have been immunized within Travis County, again, over 285,000 individuals having received at least their first dose, many of which have received their second dose as well. 47 and roughly 48% are white individuals identified as white, non-Latino. 25% identify as Hispanic Latino. Our Asian population is representative of 13% of those that have been vaccinated, and our African American Black population sitting at 7%. And we know that's lower than the overall population here in Travis County. And then when we look at male and female, almost 50% female, a little bit less than 49% male. And when we look at this overall, the hardest hit, regardless of one's individual's race or ethnicity, have been our loved ones, neighbors, family members, friends at church as well, individuals over the age of 65 been hardest hit. when we look at those over the age of 50 years of age, 32% have actually been vaccinated out of the 285,000 individuals. If you don't mind proceeding to the next slide, Ted. So this is just a great shot. This is actually one of the sites that there's many partners. Ascension Seton's been a great partner to us. Travis County, Hayes County, Bastrop County have come together with community care and Ascension Seton, strong leadership from the county judges to set up a mass vaccination site at the Circuit of the Americas down in Southeast Austin, Travis County. This is a picture of folks, volunteers that had come in and helped actually pull the syringes out of the packaging to get ready to provide thousands upon thousands of vaccines. Over the weekend, the most recent weekend, we did almost 11,000 vaccines. They were all second doses, and we're looking forward to getting back to first doses as well at that location. Ted, if you don't mind proceeding to the next slide. So to date, through community care as the vaccinator of record, we've provided a little bit over 79,000 unique vaccines. Of those, 50,000 have been first dose. And those that have completed out of the individuals that you're looking at, so really we've gotten to 50,119 unique individuals through what we've done at community care proper. And then of that, 29,000 individuals have actually fully completed, which is great. For the Pfizer and Moderna, highly effective vaccines, when we proceed after this first 7 days, the evidence demonstrates there's a 60% effectiveness at protecting against COVID-19 or the coronavirus itself. But when you get that second dose at 3 or 4 weeks, depending on which vaccine it is or thereabouts, it actually goes up very high. It gets up to 94% effectiveness, 95% effectiveness. These are levels of effectiveness in vaccines that we typically do not see. For example, and by comparison, the flu vaccine will range between 40 to 70% depending on the year. So these are highly effective vaccines. Next slide, Ted, please. And so when you look at this again, unique individuals, when we look at the comparison, we're vaccinating a little bit more women than we are males, but that's also aligned with our patient population. Our patient population actually sits at about 57, 58% female. So compared to our population, we're a little bit lower overall in terms of who we're getting to. So if you can go ahead and proceed to the next slide. When we look at who we vaccinated through community care of the 50,119 unique individuals, 57%, 58% of those we vaccinated have been over the age of 50. We were very purposeful. We wanted to get to phase, of course, 1A, which with healthcare workers initially, and then phase 1B were individuals over the age of 65. We targeted folks and reached out that way. And then went ahead and actually moved down to 50 years of age for phase 1C. And now as the state has opened up, now it's 16 plus years old for individuals that are eligible for vaccination. So next slide, please. So when we take a look at by language, the vast majority of folks that we vaccinated speak English as their primary language. Second is Spanish at 24%, and then other languages spoken. And so you see the numbers down at the bottom just kind of adding up. Just demonstrates the diversity of who that we've been vaccinating from a language perspective. Next slide, Ted, please. And so this is the one that I think is very important for our panelists and for our audience, for what we're experiencing as an organization that's very much committed to making sure that everyone in our community has access to the vaccine and healthcare that they need day in, day out, but especially those that are lower income, lower resource, and that are especially uninsured. So when we take a look overall, when we stay at the top part here is all sites, 62.2% of all of our sites, inclusive of the CODA initiative with those partners I mentioned earlier, really represents 62.2% of folks we vaccinated out of that site are representative of minority community. And then when we look at who community care has done within our own sites, we're almost at 80%. Now, by way of comparison, our overall population is around 85% minority population. And so that's concerning when we see that we're lagging, even if our own population coming in. What barriers are presenting for community members and our patients for getting in? Is it a lack of access to technology to sign up when things are there? Are there transportation barriers, other things that are coming in, as well as vaccine hesitancy, which we know is a real thing within the communities we serve. And we really want to engage in the conversation this evening to really talk about why it's important for everyone to get vaccinated. When we look specifically at our African American population, you can see overall we're at about 6.1% and 7.7% when we look at this, just the community care sites. Our overall patient population is 11.5% African American, and we serve about 125,000 unique individuals a year. So that means we're lagging about 4% comparative, which is very substantial. And so that, of course, raises concerns about why are we not connecting as well with our African American brothers and sisters? How could we do better making sure that we're getting vaccines to all of our communities, but especially our African American community as well. Next slide, Ted. So one of the things that we wanted to highlight for the audience, just so that there's increased awareness. So first and foremost, if you're a community care patient, many of our clinics actually have vaccines on site. And so you can schedule an appointment. We're offering as part of an appointment when you come through. And so you can call our patient navigation center or call center at 512-978-9015. And you can schedule an appointment to see your doctor. At the same time, they'll offer you access to the COVID-19. That's in particular at our larger sites where that's happening. And we're looking at rollouts to some of the smaller sites. We also have some on-demand services. For example, in Rosewood, Zaragoza, it's our Rosewood, Zaragoza clinic is a COVID-19 only vaccine site. So you can schedule an appointment there. But if you're a community care patient and you want to drop in, we'll take you. There might be a little bit of wait if you're dropping in, but we're going to do our very best to not only get you, but to get you vaccinated, but get you vaccinated as quickly as possible. You can also visit our website to see other opportunities. And if you're a patient and you've got technology like a phone or a computer, look for an email or text message, because we are sending out. We've sent out over 150,000 text messages or emails to folks encouraging them to get their vaccine and how they can get them. We're also looking, if we can proceed to the next slide, 10. If you're not a community care patient, which I'm sure there are quite a few that are on today's tuning in today that aren't community care patients, there's a couple different things. So if you have a mobile phone, there's a couple different things you can do. First and foremost, just want to draw awareness that we're going to be opening up additional vaccine sites within Travis County and are considering locations that are in areas where there's less vaccine occurring right now. So more to come on that, but our intent is to also open those up to community members at large. And we think that in the coming weeks, if not sooner, we'll be doing the same thing at Rosewood, Zaragoza. As we get more and more of our patients vaccinated, we do want to get to also opening up our resources to community members. You can also, in Austin, call 311, and they can assist you, or if you're outside Austin, 512-974-2000, and they can assist you in finding an available appointment near you. You can also text vaccine to 512-459-9442, and it'll give you a list. And I'm sure that Central Health, or Piers and Ted at Central Health, are going to go ahead and actually share this information as well through their social media as well. When we take a look at it, if you're a community care and not a community care patient, but you have a computer, you can also visit this website called centraltxvax.org, VACCS.org, for vaccine sites and vaccine providers. So Ted, if you can go ahead and go to the last slide. This one's one we always show with presentations, but it's our distinct privilege and honor to be here with our pastors and the bishop, really, and Dr. Moody. Just so appreciative of you taking the time to talk about this most important issue and to increase awareness about why the vaccine is so important for all of us to get. We have seen, and the personal stories are so true. We lost a staff member to COVID-19 who was way too young earlier or late in 2020. And I think when you take a look at that, and we've all been impacted by this devastating disease. And so we have a tool that's available to us. We just have to all be willing to do it and get it. So I'm really looking forward to the conversation this evening. And I know Dr. Peele is coming up next, and really are going to appreciate listening to what he has to contribute, because I know it's going to be very meaningful.
Thank you so much, Jason. A lot of great information there. And we are going to share the information that you've shared both at the end of this call, and then we will share it out with anybody who's joining us via Facebook Live. Before we transition to Dr. Peele, Mayor Steve Adler has joined us. Mayor, welcome.
Hello, and I apologize for my tardiness in joining the group. Let me begin by saying that I appreciate everything that Community Care is doing and the vaccines that it's getting out and getting them out the way that it's getting them out. The work that you did at CODA and the like, it's been just real valuable. This whole vaccine rollout process has not been set up to make sure that the vaccines get to the people in the community that need it the most, or are going to have the most difficulty in competing to get to the vaccines. Because the system generally was set up to take care of national distribution possibilities. So getting vaccines to drugstores or getting vaccines to grocery stores or getting vaccines out that way. And that may or may not be the most efficient way to get out vaccines to 300 million people in the shortest period of time. But what we do know about it, it is not a system that is designed to get it to the people that are most at risk in our community. And that's why this call is important. In addition to hearing from the people that are talking to this, I hope that you reach out to me. If you can think of ways or things that we need to be doing, listening to you, that you think that we should be doing in order to be able to get to the people that are least able to compete, with a website that opens up on a CVS pharmacy site and people are able to schedule appointments within seconds. APH right now is moving toward a non-centralized distribution system, doing a lot more mobile units, opening up distribution facilities in churches, trying to figure out how it is that we get to the people that are in the community. This is the same kind of thing that we tried to do with testing, the same kind of thing that we tried to do with the behavioral issues in reaching out to communities. We don't have this right yet. So the disproportionalities that we're seeing in healthcare generally in our community, we still see in vaccine distributions. And obviously there is a different level of trust with respect to government and things that come from the government in some communities relative to other communities. But I am real proud to be part of a community that has had a mortality rate here in the city of Austin that's less than half of the number that is the state average and less than half the number at the national average. If the state average mortality rate was the same as it is in the city of Austin, we would have saved the lives of over 25,000 people. And I'm proud to live in a city that is operating and doing things to get to those kind of numbers. That said, the crisis we're in right now is vaccinations. And as the report just showed that Giesson said, we haven't vaccinated enough people in the community, and we are not hitting at the percentages we need to hit the communities that are hardest to get to, the communities that don't speak the language, the communities where there is a trust issue and a reticence in taking the vaccine. And my hope is that you'll be able to help us do this job better. So I'm encouraged to see the pastors on the phone. Bishop, good to see you. And please tell us what it is that we should be doing in order to be able to get this job done better, because it's critical right now.
Thank you so much, Mayor. Thank you for your leadership, and thank you for spending some time with us this evening. We have a lot of questions coming in, but before we turn to the questions, I would like to reintroduce Dr. Clifton Peele with Community Care. Dr. Peele, are you there?
Yes.
Thank you again for being with us. We really appreciate the expertise that you bring to this conversation. And I wanted to start with the news of the day, which is federal authorities calling for a pause in the use of the Johnson & Johnson vaccine. don't know, I should be clear that Community Care does not use the Johnson & Johnson vaccine, but there may be some who are part of this conversation tonight who have either received that vaccine or relatives or friends or neighbors did. Can you just give us the latest on what you believe people need to know about this developing situation?
Well, first of all, with the use of the Johnson & Johnson vaccine, I wanted to be pointing out the fact that 6 individuals out of 6.8 million people who the Johnson & Johnson vaccine was tested on developed a rare form of a blood clot. Let us say that again, 6 out of 6.8 million people who were tested, used this vaccine to be tested, develop a rare form of a blood clot. The other information also is if you have received the Johnson & Johnson vaccine and any of your extremities like your arms, hands, legs, feet, thigh area have developed any bright redness or red streaking, tightness or swelling, you need to report immediately to your primary care physician or to the hospital.
Great. And this is obviously a serious situation, and I believe everybody's taking it very seriously, but does it also show that there is an effective process in place for testing the vaccines and monitoring possible side effects?
Yes, all the vaccines that are currently being used, such as Moderna and Pfizer, have gone through a rigorous testing cycle using many different individuals that are diabetic, non-diabetic, individuals that have hypertension, COPD, various comorbidities to find how these vaccines work properly. And the reason that we have so much trust and confidence in these vaccines is because of the excessive testing of the broader population that is done.
So let's start with a couple of basics, and then we will include our pastors and also some of our participants tonight are watching on Facebook Live. But can you tell us as a doctor, why are the vaccines so important and why should everybody get the vaccine?
Well, first of all, we shouldn't just look at it as a vaccine, but we should look at it as a dose of hope. This is the dose of hope that can prevent you from getting the most common form of the COVID-19 vaccine, which is prevalent in America at 95% rate of the individuals that contract COVID-19 virus. So also with individuals developing and getting the vaccine, it reduces your chance of getting not only the COVID-19, but spreading it to other individuals in our community.
We've heard this question before, and I imagine you have as well. Can the vaccine itself give you COVID-19?
Not the vaccine itself. You will more than likely develop some side effects, but not actually developing COVID-19 itself.
And the side effects are what? And how common are the side effects?
The side effects usually occur in around 43% of the population that gets the vaccine. And with this happens, you will develop some flu-like symptoms such as a cough, common cold symptoms such as elevated temperature, raspy voice, throat, sneezing, body aching, and the muscle fatigue is the most common.
Thank you. I am going to turn to a couple of questions that we're receiving via Facebook Live. One of our participants asks if they've already had COVID-19, do they still need the vaccine, or are those antibodies enough?
Yes, even if you have contracted COVID, you still need to be vaccinated. Those antibodies have been shown to only be prevalent in your body for around 60 to 80 day period. And at the 90-day period, you are eligible to receive the vaccine if you have already contracted COVID.
This is a question from one of our viewers tonight. And the question is, they say Blacks are dying from COVID-19 quicker, yet every time this person's seen people in the hospital with it, it's been white people. Is this because Blacks are not being treated for the illness, or do you have any perspective on why this might be the case, or this person's perception, what they've seen?
Oh, we still have to look at the demographics of America. Around 68% of America is Caucasian American. So if you go to any hospital, you're more likely to see Caucasian people in the hospital being treated for the vaccine. African Americans only make up around 12 to 14% of the American population. That's why you kind of see the disparity. But make no doubt about it, this virus, when contracted by African Americans, doubles their rate of dying from disease or being placed on a ventilator. That's why we must have the vaccine. We must have the dose of hope, because we do not want to see our population going to funeral homes or being placed on ventilators. That is why the vaccine is so important and so mandatory in our community.
Thank you, Dr. Peele. I know you're not going anywhere, but I do want to include Pastor Clark and Archbishop Lands and Dr. Moody. I'm wondering if you can just speak to why you believe it is so important for your congregations to get the vaccine, and why you're here tonight and part of this panel. And Pastor Clark, we can start with you.
Can I go back to the previous question about Blacks
Please do.
treated in hospitals?
Please
Number
do.
one, my dad got sick with COVID. He was in the hospital for 3 weeks. He steadily declined, and we thought we were going to lose him. And he is thoroughly African American. So just the idea, the note that, I want to make sure to put a face on this. And the reason why I think that's important is because there was a young lady I was talking to, a member of our church. We really have been, encouraging people to get vaccinated, not trying to violate their adulthood or anything like that, but really encouraging people to get vaccinated. And she was skeptical. She had chosen up to this point not to be vaccinated, up to a couple of weeks ago. And she told me that the reason why she got vaccinated was because we had consistently told her that it was a wise choice, or at least something to pray about and consider. And then she had one of her friends die. And that whole personal experience is just quite important. So why is it important for our congregations to be vaccinated? I think it's, first of all, just essential from the role of the African American church in our communities. We are still the most influential organization in the African American community. And that influence has to be leveraged in this critical moment, not only just to support what needs to be done throughout our country, regardless of race, and throughout our city, regardless of race, but knowing the disparate impacts of this virus on us and how it behaves in our community. I just think it's so essential. So every pastor, every church leader, every organization, it just is such, I think, not only a wise choice, but a God choice to involve ourselves in those things that promote health. In fact, when you think about it, most of the hospitals and those medical institutions, many of them were founded by Christian organizations. And so we continue the long legacy of contribution to the world in terms of health when we do that.
Thank you, Pastor. Archbishop Lands, I'm wondering, what do you tell your congregation, and what are you hearing from them? What are some of their concerns, and what's making some people perhaps a little bit hesitant to get the vaccine?
One, I'd like to piggyback on Pastor Clark's statement and go back to the subject. Racial and ethnic minorities have faced challenges in having access to medical care all over the country, and particularly in Texas. When they receive it, generally their care is not equivalent to that for other groups, or at least unless they have deep pocket insurances, medical insurance, they don't get the care. Now, why this is so is probably a complex issue involving not only possible differences in ability to pay and provide a behavior, but also in such factors as patient preferences and differential treatment by providers and geographical variability. So there are many complex elements involved in that interface and interactions, which will cause many in the Black community to pause and take a wait and see attitude. And then we have the history behind us. You know, we all know about the project where the young men, the Scottsboro group, where the syphilis thing went on, and that was done intentional.
Right.
And there are many people right now in the Black community who believe that there are other such projects that have gone on in the last 50 years or so that we're just not aware of, and history will one day reveal them. So there's a lack of trust. Matter of fact, I probably should say there is a total distrust
Right.
in many of the arenas where we are active. And then there are those who believe that that this whole pandemic thing was a hoax, and that it was never real, and that it was designed to thin out the herd, if you will, and take out the weaker people and the elderly, and thereby reduce the numbers of people globally. And I've heard that from some of my people in our fellowship in West Africa and in Europe and several other places. So the point I'm making is that there are many elements associated with the concerns that we're expressing tonight. In my own congregation, we have some members who took the Johnson & Johnson vaccine just very recently, only to wake up this morning and hear that they have this problem and there's a hole. Now, don't forget, AstraZeneca went through the same thing, and they had to go through a freeze for a while. So when I hear numbers like 6 out of 6.8 million, that's offensive to me, because to the 6 people, that's very important. So we can't take the triage approach when we're talking about vaccinating people. The 6 people are very critical, and we need to know what it is that caused the blood clogs, since the blood clogs are considered to be different than others. I worked for the company for almost 17 years that owned Pfizer. So I'm very familiar with how it's done. I know how the testing is done. I know that we did not have a lengthy beta testing. We did not have a lengthy alpha testing. And so this thing, because of necessity, I'm not finding fault with it. I'm saying it was a necessity. But the reality is that it had to come out in a hurry. And so the people that are taking the vaccine right now sort of see themselves on one side of the highway as guinea pigs, on the other side of the highway, because they're more informed and have a better access, they believe that it is okay. I went to get vaccinated back in February with the Moderna, and when my wife and I walked in, there wasn't a Black face in the place, and there were about at least 50 different stations inside, and there was a line outside. And well, there's a reason for that, you see. We can't say, well, the people didn't know. Maybe they didn't. I don't know if they did or not. But I can tell you up front that the ratio of races or ethnic groups in there was a very telling statement. So, I don't think we can be too cavalier in our approach to the problem at hand, and then the problem that exists with our people. I've had to bury people. Some of my close friends, because I'm in that age group, have gone on at transition as a result of this, and it's a heartbreak, actually. And so yes, I tell our people all the time that it's necessary that we take the proper precautions, and now that the vaccine is available, that is a proper precaution. However, I don't drum it into them that they have to do something. What I do is try to make certain that that they're informed, so that they can make an informed decision.
Thank you, Archbishop. Dr. Moody, I know we've had this conversation regarding the vaccine and which vaccine people should get, and there's been a concern that maybe certain vaccines are being only administered to certain populations. What are you hearing from your congregation and from the people that you interact with on a daily basis?
Of course, my people are talking about, the first thing is, the ratios of people that are there.
Right.
That's problematic for everyone, because when they do go to get the vaccine, there's an issue of people jumping the line. And that jumping the line has everything to do with economics, has everything to do with opportunities. So there's concern there. There's some, that have talked about, I only want this one, or I only want that particular vaccine. Some have said that their doctor recommended this one versus that one, but there hasn't been a big pushback in terms of which vaccine to take holistically at all. It's really been whether I'm going to get it or not, whether I'm going to do this or not. That's been the major concern. And like my brothers of the faith have said, and it's because of all the history, and the African American church has historically been not just a beacon of influence, but it has been the bridge that has bridged every issue of inequity historically, whether it's education, whether it's housing, whether it's economics, and now in health. And so we're pushing the idea of getting vaccinated, and we're not telling them, of course, get this one or that one. We're saying, just get the vaccine.
And I think what we've talked about as well, and I should say that Dr. Moody and Community Coalition for Health is a partner with Central Health, trying to get people to get the vaccine. But a big part of that is also removing barriers. So making sure that there's access, and a drive-through vaccine site is good if you have transportation, if you can get there. And that's some of the things that we've talked about, right, Dr. Moody?
Right, and it's got to be, it doesn't make sense to do a drive-through vaccine site on the wrong side of town. Right. I mean, if you're going to do a drive-through vaccine site, you got to put it in the place. You can't, I guess what I want to say is, you can't fake access. It has to be, you have to put it in the place. An older person told me, you got to put the cookies where the people can reach them. And so that means we have to not just look at location, we have to look at times that they are available. We have to look at dates and times. If you make it between 8 and 5, but many people of color have to be at work, you did not increase access. So we have to really talk about, what access means, and then really examine the characteristics of the populations that we're trying to reach, and make it so that they can actually get to it.
Thank you. I do want to turn to some of the questions that are being, the comments that are being posted on Facebook Live, and bring Dr. Peele and Giesson Fournier back into the conversation. But one of our viewers is asking, how does the vaccine affect people with COPD? And Dr. Peele, that might be a good question for you.
So people with COPD have experienced some exacerbated symptoms after taking the virus, but generally that comes after the second dose, and those symptoms only tend to last for 2 days. And the symptoms that they experience are often sometimes coughing, and sometimes some phlegm coming up with the cough.
Hold on.
And when you go to get the vaccine, you actually fill out a questionnaire about some of your underlying health conditions, correct?
Yeah, yes. It's an extensive questionnaire.
Giesson, were you going to say something? I'm sorry, I thought I heard somebody trying to speak. Okay, we have another question, which is, and this one, Mayor Adler talked about this, and Giesson, you touched on it, but Dr. Moody, you and I were just discussing, for those who lack transportation, how will they get vaccinated? And I know the mayor talked about mobile APH working on mobile vaccines, and I know Giesson, community care clinics are now offering vaccines at the clinic sites. Perhaps you want to talk about that for those who lack transportation, or maybe can't get to one of the larger hubs.
Yeah, absolutely. So critically important that we're here to help with that, not just us, but APH, trying to make this as accessible as possible. So within our individual clinics, there's vaccines that are being provided. So if folks are a patient in community care, we're able to get them the vaccines. That way, if you're not a patient, you can always become a patient, right? We'll see you regardless of your ability to pay, regardless of your insured status. So you can call the number that was shared earlier. The other part though would be and what we do with our partners at Townhall, but community care directly, someone has transportation issues, then we're able to help with getting transportation. If you don't have a friend or a family member that can get you to a vaccine site or get you to one of the clinics, we can help with a voucher for a cab or a bus token, whatever your preferred mode of being able to get from point A to point B, we can help out with that. So again, if you call the call center, they'll be able to navigate you through that.
And that number is 512-978-9015.
That is correct, Ted. Yeah.
And we have another question, which is a really good one about people who are homebound. So they receive in-home care. How can they get vaccines? And I do know that Austin Public Health is doing more of that and has partnered with Meals on Wheels, but I'm not sure if the mayor is still with us and might.
I am.
Hi, Mayor.
Yeah, I would urge people to call 311. That's the number that they'll take down your name and your phone number, and they'll give it to their health line, their nurses line, and they'll arrange for people that are homebound to have someone come by with a vaccine. So I would have them call 311. If they, for whatever reason, can't get through there and can't access it, tell them to call my office.
Thank you, Mayor. And we, Central Health and Community Care, are also pushing 311 as an option for people who may not have access to technology or be able to go online and make an appointment. That's another option that we're also using. So 311 is an easy to remember number and a good one that people should keep handy. I'm going to go to another question. And it really goes back to a question, Dr. Peele, that you already answered, and one that actually I've had before based on a relative. But if you've had the virus and you have the antibodies, can you explain why you would need the COVID vaccine? Or do the antibodies, I was having this conversation with a friend this weekend, do the antibodies last only a certain amount of time? Or can you explain that again for people who may be a little bit confused? If you've had COVID-19, why you should still get the vaccine? And is there a window of time before you can get the vaccine?
Yeah, so the antibodies only have an effective period of time to fight the vaccine. And usually the effective period of time is 90 days after contracting the COVID-19 virus. So generally after the 90-day period, those antibodies are no longer effective in fighting the COVID-19 virus. And that's why generally after the 90th day, it is safe for you to get the COVID-19 vaccine.
Thank you. Here's a question, Giesson, that everybody I think has touched on it in different ways about the mortality rate. But why is it so much higher for African Americans, Dr. Peele? And is this because of underlying conditions? Is that why it's so much more serious for the African American community? This is a question from one of our viewers.
Yeah, so Dr. Peele, you're on mute, but I can start, and then Dr. Peele, you can kind of chime in. So when we take a look at our African American and Black population, unfortunately, there was longstanding persistent disparities, and that's along the lines of chronic diseases, right? So when we take a look, our African American neighbors suffer from hypertension, heart disease, other disease processes that place them at higher risk for an adverse outcome as a result of getting infected with the coronavirus. And so those things coupled to also a higher level of individuals who have lack access to resources, a higher number of individuals who are uninsured, especially adults, right? All of those factors come into play. And so you might have someone who delays gaining access to care as a result of that. So I think those are all things that are contributing to why we're seeing a higher rate of mortality within our African American communities, unfortunately. Dr. Peele, anything you wanted to add, sir?
Oh, yes. And another reason for why there's a more experience of mortality rate in the African American community is that African Americans are already at what we call suffer more pre-existing conditions than other racial and ethnic groups in America. So we have a higher prevalence of diabetes, hypertension, obesity, COPD than other groups. And with you compounding this with the COVID-19, make this a very difficult virus to overcome and survive.
The COVID-19 didn't create these health inequities. It just further exposed them, correct?
Yes, exactly.
I'm going to go to another health question, then we'll go back. We've got so many leaders on this call. There's one, I think, for everybody, and you've been addressing it. But first, Dr. Peele, this person's asking, is it safe for an elderly person with Parkinson's or perhaps other underlying health conditions to take the vaccine?
Well, first, if it's just the Parkinson, it is. But if it has another comorbidity, I would have to know more in depth.
Okay. And this is what they need to, if they go to get the vaccine, they need to make sure they fill out the questionnaire and ask those questions.
Yes. Exactly.
So somebody's asking, and I don't think anybody here would argue that the distrust about this vaccine is valid. And we could probably just say that distrust in the healthcare system is valid. And they're asking, what can we do collectively as leaders to address this and hopefully change this and earn people's trust? And I'll open that one up for anybody who would like to take that.
Well, I'd like to at least jump on this. Biological racism is the pseudoscientific belief that there's empirical data or empirical evidence to support or justify racism or racial inferiority or racial superiority. And down through the years, you have seen it used to make decisions that are inequitable as it relates to racial access to various and sundry needed items. So, for instance, when we talk about, and I just heard Dr. Peele mention, and I will only repeat it, diabetes, and that's very real. That's a serious problem in the Black community. But diabetes in and of itself is a symptom of something else. And it has to do with lifestyle, it has to do with diet, it has to do with a number of other things. And yeah, there could be some genetic issues, but most of the cases that I know of, and I know of quite a few, really have to do with other areas and other elements. So with that in mind, I believe we need to start to debunk this whole biological inferiority lie and not act as if it doesn't exist. It's an elephant in the room, and we talk about everything else, but the reality of the racist views that have been passed on. For instance, probably no one on this call is holding those views, but they've still shaped the culture that we live in, and we're still responding within that shaping. So I think it's time for us to step out of that and start dealing with some of the other causes of health issues in the community and make the pandemic part of that. But we can't say that it is the only thing or the primary thing. Yes, it is heavy right now, but it's not the primary health issue in the Black community. And so I think we need to dismantle that whole concept of biological racism or scientific racism.
I'd like to jump in here, if I would, Ted, to say that one of the things we have to look at, and I'm so glad that we have Mayor Adler on the line, is we have to look at the correlation between city planning and the allostatic load. When we plan cities and we plan transit systems and we plan housing developments, there are planners that put these projects together, and those projects have long-term ramifications. Allostatic load is increased, this medical term where the pressure and the stress of just living and being me. It's harder to get to the grocery store because I live in this neighborhood. It's harder to get a better education because I go to this school. In this neighborhood, Right across the street from the school, we have the police academy. So while the children are testing, the police are having, firearm practice. So when we talk about planning as a city and we look at sustainable economic and community development, we have to think about it in terms of how we're planning these neighborhoods. It's not just gentrification, because gentrification is a major issue, but it also goes to just you plan out lifestyles, and those lifestyles have long-term ramifications of additional stress, which changes the hormones, which leads to diabetes and those things. We have to look at that correlation and really, really have some tough conversations about it.
Well said. And these conversations have to continue long after the pandemic is over.
Absolutely. Absolutely.
Yeah, I think, Ted, the one thing that I would go ahead and really appreciate the comments very much is I think part of it is just acknowledging, right, that there are these concerns.
Yes.
And from there, you start moving forward, right? And that's where the conversation really needs to be. And not to be shy about having the conversations, like recognizing that folks are hesitant for very real reasons that are deeply rooted, and meeting folks where they are, and just trying to engage in, person to person, and just, we're trying to protect each other by getting a vaccine, but it's so much more than that, right? We all deserve long and healthy lives. And for very real reasons, not everyone has equal access to that, right? And I think that's where this starts. And it's heightened right now because of the pandemic. And maybe that's a blessing in that it's heightened because it's drawing attention to something that really needed to be paid attention to for a long time, right? And so if you're going to try to glean something that's good of it, maybe that's one of the only good things. But I think acknowledging is where I think we need to, especially for myself as a white male, for sure.
Just a few years ago, guys, well, it's more than a few now, I guess maybe 10 to 12 years ago, I was part of a project that built 300 homes out in the Colony Loop area. And then we did another 500 units out there with through another contractor. We built 235 units out on Decker and another 130 plus over here off of Clayton. In the Decker area at that time, we were just on our knees virtually asking for one of the large stores like a H-E-B, and that time we had Randall's over in the nearby area, or Randall's, or even some of their competitors, to just build over in that area so that the people would have access to just good grocery shopping. And I'll be honest with you, over that 10-year period of time, we were turned down time and time and time again. They'd say there are not enough rooftops, or they don't have the right economic level, and all those things. Well, those are the types of things that cause the people who are already struggling to even struggle more in order just to make one day at a time. So I think you've hit the nail on the head, Dr. Moody, and to the rest of you.
And Archbishop, I may be wrong, but I'm not sure a store has been built there yet out in that area.
Well, I wasn't going to say it,
No.
but yeah.
I want to, and I don't want to cut anybody off, but we do have some more questions I'd like to turn to, and as we continue the conversation, and this one is actually related. So this may be either Dr. Peele or Giesson, but is one vaccine okay? And I think we know that there is efficacy with one vaccine, but I'm not the doctor, so I'll let you answer that. But also, do we know yet how long the vaccine lasts? And will this become an annual vaccine similar to the flu vaccine? I think I added that last question, but is one vaccine okay for the dual dose? How long does the vaccine last? And do we know yet if this will become just an annual part of our lives, getting the COVID vaccine?
Well, the good answer to that question is we don't really technically know how long the vaccine is going to actually last, and it's in the works now that this possibly could be an annual thing of us getting the vaccine, but it's not been proven for sure yet through the CDC. Yes, and along with Moderna and the Pfizer vaccine respectively have 96% efficacy versus 97%. So they both are, the two main standard dose of viruses are pretty strong as COVID-19 strand.
Yeah, I think what I'd add, Ted, to Dr. Peele's comments is so the question about, is it okay just get one? Our recommendations are to get them fully vaccinated. That's how the vaccine goes ahead and protects you from the life-altering, disease-causing implications of COVID-19, right? And so the first vaccine confers immunity. It does protect, but that is enhanced significantly by the second vaccine. And I think as we're planning with peers on both the public health side and in community care, I think we feel pretty strongly that this is going to be an annual event moving forward, that we're going to need a booster so long as the virus continues to transition into different variants in that. And so the good news is there's some great scientists out there working on enhancing the vaccines and that. But I do think, for the audience, when we talk medically about this, it really does look like we're going to be doing this once a year, just very similar to the flu, right?
So Jason, along those lines, do you know about the data regarding, is there a drop off between the first and second vaccine? And has it been challenging to be able to return to get that second dose?
Yeah, I think so. There's some data that goes ahead and demonstrates that further out that the immunity reduces over time, and hence the reason why both Pfizer and Moderna relative to the messenger RNA vaccines, and the technology around that has been around for almost 20 plus years, right? And yes, it came about fairly quickly, as the Archbishop indicated, because of the circumstances we were in. But when we take a look at it overall, there isn't really a little bit of a reduction of immunity. That's why you need to go ahead and get the second shot. And so we want to encourage it. As it relates to getting the second shot, for the patients we're serving, or the mass immunization event that we're helping to support with partners down at CODA, as well as what APH and so many others are doing within the community to get it out there, I haven't heard significant concerns about folks getting the second dose because the vaccines are already available to us. Once we give the first dose, for example, we're scheduling folks for their second dose already. The vaccine's already available to us, so that we know that it's coming through either the state or through the Centers for Disease Control. And we're pretty fortunate at Community Care. We're now getting a direct allocation from CDC of Moderna, and we have the vaccine. We are seeing that there is around a 7 to 8% no-show for the second vaccination, though, for whatever reason, and we're still trying to better understand why that is.
We've talked a lot about vaccines tonight, and Mayor, I know that you've been pushing people to continue to do all the things that we need to do to stay safe, and the vaccine is just part of that. So we still need to continue wearing masks. We still need to continue to wash our hands or avoid large gatherings until people have been vaccinated. I'm just wondering if is that a message that's resonating with people? And can anyone just speak to the fact that the vaccine is not the end all be all, correct? We've got to still keep practicing safe, healthy habits. Mayor, did you talk about?
I was going to say, I hope it's resonating because it's saving lives. We talked earlier about the low mortality rate we have in Austin, and I think that's because a lot of people in Austin are willing to take those steps. And it's real important to know that you don't wear a mask to protect yourself. You do that to protect the people around you. I mean, there is no more giving thing you can do than to wear a mask to protect those around you. And all these things, if you follow the data and you just believe the doctors, it makes a difference. And I would just conclude with, you need to do all the things other than the vaccine, like masking. Vaccines are also important too. You've been having a conversation about lots of different kinds. I took one kind, my wife took a different kind, and my 3 daughters have each taken different kinds. And even with the news that's come out, I took the J&J vaccine. last week. So I think it's just important for everybody to take the right vaccine is the first one that becomes available to you.
Thank you. And I want to also emphasize that we are still encouraging people to get tested. So Austin Public Health, Community Care, and Central Health emphasizing the need to stay positive, test negative, and get the vaccine. Those are all important. We have one question regarding data. Is there any data in Travis County about people who have received the vaccine but still contracted the virus?
So I'm not aware of any data that demonstrates that where folks have been vaccinated and received it. What I can tell you based on our own cohort of employees at Community Care, we actually, and this is a good example. So, you know, almost all of our employees have been vaccinated. As healthcare providers, we felt it, and healthcare workers thought it was very important to protect ourselves so we can protect each other, so that we can protect the communities we're so privileged to serve, right? And so we don't have any, and these are folks who are at high risk to contract the virus because we're working with patients who may be infected, right? And so we have no evidence of anyone who's been vaccinated contracting the virus and getting sick from COVID-19. Actually, we have the contrary.
Right.
At one of our clinics, and I don't mind sharing this, we had a clinic where very early in January, we had a good group of folks who had gotten vaccinated. About 19 individuals had been vaccinated, and 16 had not. And it was just the first dose of either the Pfizer or the Moderna. And then that second dose hadn't been given. But for folks who weren't vaccinated, 13 out of 16 actually ended up getting sick and contracting COVID-19. And so it really speaks to the effectiveness. And these were folks who were working in close proximity with each other. And so folks who were unvaccinated got sick and contracted COVID-19 and potentially exposed their family members. And those that were vaccinated with just one dose actually did not get the disease.
You know, Ted, Dr. Burton, I would just add to that because I was just with Dr. Escott and he told me he thought there were 32 cases in Travis County where people had been vaccinated and contracted the virus. But that's to be expected because we know it's not 100% effective. So there are always going to be those numbers. But the important thing is that with these vaccines, someone who gets infected very rarely ever ends up going to the hospital. And it's even more likely that they're not going to die. So even though there'll be some people that may actually get the virus, it is still absolutely the right thing to do.
Thank you, Mayor. As we come towards the end of our evening, I do want to, we want to circle back and share some critical information, and we'll do that before we close. And we will also send that information out. But just a couple of points, and you've already made these, but the vaccines are safe, effective, and free. And that's a really important thing to remember. The vaccines do not cost anything. And we've all been emphasizing the need to continue wearing masks. There are a lot of resources for getting information about the vaccine. And I'll try to go through these, and perhaps if Anastasia can pull up that final slide that Giesson shared, but you can go to communitycareatx.org or call Community Care at 512-978-9015. A real easy number to remember is call 311. If you don't have access to the internet, or somebody in your family or your circle does not have access, they can call 311. And as the mayor mentioned, arrangements can be made to bring a vaccine to people who are homebound. Here on your screen, you can see some more information. If you text vaccine to 512-459-9442, you'll get a list of resources in our area. And as Giesson had mentioned, Community Care is currently vaccinating Community Care patients. If you're not a Community Care patient and you have a computer, you can go to centraltxvax.org. That is centraltxvaccs.org. That is a lot of information. We will share this on our social media channels. We will push this out every way possible. I do want to take a brief moment to thank our esteemed panelists. It's been an honor to be in your presence and to have you share words of wisdom, and would like to give you an opportunity to share a closing remark if you so choose. Thank you, Pastor Clark, Archbishop Sterling, Lands, Dr. Moody, Dr. Peele, Jason Fournier, and Mike Giesson, and of course, Mayor Adler. We really appreciate your time this evening, and we feel like it's been a great conversation. And I would welcome anybody to offer closing remarks.
I would like to say that I so appreciate Dr. Peele and Jason and Dr. Moody, Pastor Clark, and of course, Mayor Adler, and you, Ted, for even doing this. I think that this is one of the ways that to jumpstart any of the historical issues, we can get in front of the curve and help our people. So thank you so much, gentlemen, for investing in this time.
Thank you, Archbishop. Anybody else?
I want to thank Mike and Central Health. We've been working with you for a while now, and thank you for working with C2H and being a partner, listening, and being able to invest your time and your talent to trying to address these real issues. And so I appreciate you. Thank you, Jason, for all that you're doing, and Mayor Adler. And then I just want to appreciate once again my brothers in the faith for all that you do. And thank you, Dr. Peele. I appreciate you for your time.
Thank you, Dr. Moody. And thank you, Dr. Moody, for helping arrange this. We really appreciate you and your team for helping make this happen. Anybody else have any final thoughts?
I just want to thank all of the peers on the panel. Really appreciated all you've said, and really just an honor to go ahead and be part of a community that's willing to go ahead and make sure that folks are getting what they need. So thank you so much, gentlemen, for participating this evening with this most important issue.
Thank you.
There's a saying that says that good things happen only at the speed of trust. And I just really appreciate you all speaking to the community this way, because yours are the voices that the people in this community trust, and you'll lead to good things happening. Thank you.
Thank you, Mayor.
Oh, yes. I would like to thank everybody for being on this panel and even inviting me to participate in this robust discussion, and a great discussion that was just, I think, God sent. And I just want to leave with a Bible scripture: for my people are destroyed because of their lack of knowledge.
Thank you so much, Dr. Peele. And thank you for taking this time out of your very, very busy schedule. We know that you have people to tend to and care for, so we really appreciate your time, sir. Pastor Clark, I wanted to give you the opportunity if you had any final thoughts.
Oh, I was thinking that my brothers have already expressed a similar gratitude that I have, and I'm just happy to be a part of it. We're very, very passionate about this. If there is a way that Greater Mount Zion can serve in any way, we certainly would love to do that. But thank you, Dr. Moody, for having me to be a part of this, and to each and every one of you who are doing all you can to ensure that we address the needs of the moment. I so value that. Always good to see you as well, Mayor Adler.
Thank you, Pastor.
Thank
and
you.
Mike Giesson, our Central Health CEO, I believe you're still there. I didn't know if you wanted to share any final thoughts.
Yes, I want to thank everybody that's on Facebook right now that's tuned in and listened. Thank you so much for joining us. We hope that there are some messages there and some words that have resonated, but also that you can take as you're having your conversations. And to the medical experts on the call here and our pastors and brothers in faith, I want to thank you all for being here and sharing your stories. And I think it's great that we've gathered at this intersection tonight where health and ministry come together because there's compassion and there's love and there's wanting to reach out and help and serve. And so I think there's a lot of strength and impact that could come by us coming together and meeting at this intersection. And I hope we come here many more times again. Thank you.
Thank you, Mike. My dogs are shaking their collars, so I know that they're trying to tell me it's time to wrap up. I do want to thank my team behind the scenes that is making this all happen. I'm just a mouthpiece here asking questions, but we have a really amazing team behind the scenes that made the Facebook Live possible and have been running this platform for us tonight. So they're the unsung heroes that are behind the scenes here late with us tonight. I want to thank them for all of their amazing dedication and support. And I did mention at the very beginning, this is a series of town halls. We have more events coming up and we will publicize this every way possible, but we have town halls planned on Tuesday, May 4th, Tuesday, May 18th, Tuesday, June 1st, and Tuesday, June 15th. And we are also looking to schedule other town halls with other congregations that reach different communities. So grateful for everybody's time. Thank you for everybody who joined us on Facebook Live. And we will continue to monitor your comments and questions and answer those. And I would just say, remember to stay positive, test negative, get a vaccine. And together, we really are going to be stronger than COVID-19. If we stick together, we'll get through this. So thank you so much, everybody, for your time. We really appreciate it.